Okay, so hearty good afternoon and welcome to our session on birth deformities. We are glad to have Dr. Anand, Allam, Venkatesh among us today to help us understand the topic. Birth defects happen when the bone and muscle tissues develop abnormally in babies during fetal development. Also, the causes for about 60% of birth defects are unknown. So, birth defects may range from mild to even serious health issues. So I would, you can ask any questions you want to. You can clear your doubts by asking our doctors related to birth defects. Now, doctor, you have the stage. Please continue.
Yeah, hello, good afternoon, everyone. I am Dr. Anand. I'm a pediatric orthosurgeon. So that means I operate over kids only who are from day 1 to around 16 years of age. So any baby having a limb deformity or spine deformity, something like neck deformity, what do you say, the thorax deformity or pelvic deformity, and walking disabilities and limb losses and all these things, I operate that kind of cases. So today we have joined through Apollo Cradle. Thanks to Apollo Cradle management for giving me a small opportunity to talk about birth defects, deformities, and disabilities that babies go through because of developmental issues and also congenital issues. So firstly, talking about birth defects, we need to know about a little about embryology of a baby. So embryology is something like when a egg and a sperm they join together and make an embryo. It goes and gets implanted into the uterus. Then starts a great process of a baby developing to a multicellular organism from a unicellular organism. In that situation, the most important period is the first 4 to 8 weeks actually. So for the first 4 to 8 weeks, limb buds, always limbs are developed from small limb buds, that is upper limb buds and the lower limb buds. So these buds are developed around 4 to 8 weeks of time. So in this time exactly, if at all there is any issue with the parent, I'll tell you what are the etiological factors next. So talking about the embryology, this 4 to 8 weeks of gestation especially are very crucial, because at this time only the limb buds are actually formed, and after that it's only the expansion of the cellular matrix and the size of the limbs. So that means that mold is already prepared and it's just expanded further and further into a bigger kind of organ, that is our limbs. Then also spine also actually develops through two dermatomes, like as if it's two different bricks and with a zip in between. So when the zip starts closing like that, slowly the spine also gets joined into one huge brick like that, and inside that will be a spinal cord. So talking about what do you say, ectodermal origin and all these things are a little confusing for the parents. This is mostly for the parents actually. So when you look into the etiological factors, that is mean what would be the first reason of defects in a baby. So when you look at it, that can be environmental factors, that is the patient getting exposed to radiation or taking a very bad nutritional care during the pregnancy, and also getting exposed too much to pollution and other stuff like in this situation, and also having very bad dietary habits. And second thing is maternal factors, that is mother having a very bad nutritional status, as I told you already, or not taking medications properly, especially getting exposed to few drugs. Especially thalidomide was a very disastrous drug that was given during the 1900s in what do you say, in UK side, where the babies were born with seal kind of limbs without the distal part of the limbs at all four limbs. So that is called as thalidomide poisoning. So drugs also, what kind, most of the drugs, when you classify drugs actually, during pregnancy also, gynecologists will explain you a most important thing, that is A, B, C and X category drugs actually. So when you look at these drugs, the A category is something like which is a very safe drug, something like your multivitamins and your folic acid. Folic acid is the most important drug actually you should take for the proper development of a baby. And next things will be your other B and C. As the things go bad and bad, more and more distal, it means it is more and more dangerous to the baby and to the mother actually during pregnancy. And also talking about class X drugs. Class X drugs are absolutely contraindicated in pregnancy. So whenever you are, whenever any doctor prescribes you a drug, make sure you check about it. Ask the doctor that what category of drug is this, and is it really dangerous to my baby or myself or anything like that. So make sure you ask that. Class X drugs are very, very important. Class A drugs are the only drugs which are FDA approved and which are very useful in pregnancy. Next, talking about other factors, something like infectious diseases, especially torch infections are some infections, and if at all mother living in unhygienic conditions or going through pregnancies continuously without any gap, having very bad health, and having and another baby who is breastfeeding and having another baby without any gap, these kind of social and environmental factors also determine the health of the baby that is growing now in the womb of the mother. So make sure that you have sufficient gap at least 2 to 3 years in during your pregnancies, and also make sure that you also make sure that investigations that you are getting done properly are through the proper gynecologist. Every gynecologist is good, actually. They are dealing with two very, very beautiful lives. So make sure that you get proper regular checkups, and also not get exposed to irradiations, especially when whenever you go to an X-ray, like you get an injury, you fall down or something like that, you see in an X-ray department telling that there is hazardous X-rays, radiations are going on, and if you are pregnant, please let us know. So make sure you are far away from X-ray, and CT scan machines are even more dangerous. So whenever your relatives are also getting it done, please make sure you are kind of a little far away from the place, because whatever lead coat we are providing, it is better you don't get exposed to any of the radiations. And whenever you are getting an X-ray also, make sure you always tell that you have this issue, and you are pregnant now, and make sure that you inform the technicians and the doctors there to make sure that they write a non-invasive procedure investigation, something like a ultrasonogram. MRI is also fine. Ultrasonography is the most safest investigation, actually. So we most of the time replace our X-rays and CT scans with something like a more minimally invasive thing, that is USG and MRI. So these things are very important for mothers. And another thing, yeah, as I told you, nutritional supplements, and not getting exposed to drugs that are very dangerous, and environmental factors, and maintaining good active lifestyle. That is, now many programs have come up, like pregnancy yoga, and many of my friends also run these programs. They do a really good job. So with that, the patient is always active. The more active the mother is, the better chance of having a more healthy baby, which will have very good life in future also. So these are the basic factors which really affect, as I told you, infections and drugs we use and radiation exposure, and your nutritional status. These are the most important stuff. So another thing, talking about this is about the etiological factors, and what are the defects that can occur in a baby, especially when mother, any of these issues happens and the mother gets a defect. As we are talking in a chronological order, as you can see, there is something called, very important, called as a TIFA scanning. That is a targeted imaging for fetal anomalies. So in that, what the radiologists see is that they make sure they see any limb defects or any spine defects or any head and chest and abdominal cavity defects. These kind of defects, they classify the defects into different various severity scores. So when you see, I'll be mostly dealing with limb deformities and spine deformities, so I'll be talking more about that. So when you look into it, so these kind of abdominal defects and chest cavity defects, cardiac defects, all these things and limb defects can be properly found out between the ages of 16 to 24. So TIFA scanning actually is done between these weeks, especially the 16th week scan is very, very important. And also there is something called as nuchal translucency, that is to see for trisomy 21, that is the Down syndrome babies. Especially, I don't know how many of you really know about it. It is something called, it's a chromosomal anomaly. When you have a chromosomal anomalous baby, that if at all you find out it in an earlier stage, it is better you abort the baby so that you can go for the next pregnancy with having a better, healthier baby, so that the baby and the parents don't suffer for the rest of their life with a little deformed baby. It's like that. So it's a hard decision, but you have to take that. So at 11, 12 weeks, generally they do that. So after 16 weeks, it's mostly the TIFA scanning. So TIFA scanning, what all they see is that first they see if the head and the facial this thing, and also external ear canal, and the cervical spine, thorax spine, and the lower spine, and also your upper limbs, the chest cavity, the cardiac activity, and the abdominal cavity, and the lower limbs. So all these things are properly formed, or is there any deformity or any defect? There is a difference between a deformity and a defect. Deformity means the limb is formed, but there is a little crooked deformity, something like the most common deformity is a CTEV. Many of the patients come to me with a 16 weeks, 17 weeks scan and ask me that the radiologist is telling us there is something called as a CTEV, that is congenital talipes equinovarus, that is club feet. Actually, it will look like a club of a golf, so it's called as club feet. The foot actually, which has to be straight and nice like that, will be something like crooked, inward, turned out inward like that. But thing is, these kind of deformities are not very serious. Generally, more than 65% of these babies actually have no deformity, only because the baby will be moving in the womb like that continuously without any rest. The baby at different positions, the limb looks a little different. So whenever you have a doubt, go for another scan. And also there are fetal medicine experts, as we have Dr. Amita in our Apollo Cradle. She does an amazing job. So whatever deformity she finds with the baby, she tries getting it back to me, and I also we discuss the case, and then we talk to the parents and tell them what is the situation. So when you see, there can be some defects with the upper limbs, especially when you see a baby in 16 to 18 weeks, and then 20 weeks, 24 weeks. We do follow-up scans, something called as for every 1-2 weeks. So when you see a limb deformity is like when you have a crooked upper limb or a crooked lower limb or a hip issue or anything like that. Generally, we don't trouble the baby, because as long as the limbs are properly formed, completely formed, and have normal contour and shape, and not about the contour also, if at all they have a proper entire limb, like an entire femur, entire tibia, like that is the thigh and leg and foot component, then we don't disturb the baby. We make sure that the parent gets the entire checkup done properly, and then if at all required, do a genetic test, and then make sure once the baby comes out, we start treating the baby immediately post delivery. So that is very important. And another thing, defects of the baby. Defects means that means one part of the limb is missing. That is the upper limb. Sometimes for some fingers will be missing, or some fingers will be joined like that. That is called as a syndactyly. Or the most common defect is having an extra finger. Extra finger is like pre-axial and post-axial. They are classifications in that. So in that, what you see is there is another extra finger. It will be a complete finger or an incomplete finger that we can see in the scans. And another thing, having the forearm bones, one of them missing, or one of them or both of them missing, or a complete transverse missing of the both complete upper limb like that. Or elbow, having some issues with the elbow, joined elbow or something like that, where the baby cannot twist the upper limb. Or having an entire limb loss for a baby, the entire complete right limb loss. In that kind of situations, we give the parent a choice, telling that, see, your baby is actually going to have a defect, and we are going to try to put prosthetic limbs to the baby as the age grows, and give them good physiotherapy to gain minimal to do daily day-to-day activities and daily activities of living, and make them productive for themselves and for the society. So if at all there are very severe deformities, both upper limbs absent, both lower limbs absent, and some chest wall defect or cardiac defect, associated syndromic baby, then what we do, we take from some cells of the baby and then send it for examination. So once we send that that cells for examination, we get back a genetic report telling that if at all the baby is suffering with some syndrome, or baby is going to, what is the future of the baby, you find out with genetic tests, actually these kind of tests. So when you do this kind of tests, so you find out there is the baby is suffering with some syndrome. So we mostly will get an idea of the entire life of the baby, that what are all the other associated anomalies, like any kidney issues, any liver issues, or any cardiac issues, or brain issues, or something like that. So once we look into all that, once we see all that, then what we do is we give the choice to the parents that this can happen. So this is the severity of deformity and severity of issues of your baby. and do you really want to continue the pregnancy or do you want to drop it? So that is, the choice is kind of entirely of the parents. Only the doctors can only guide them to do what is right for them. And another important thing, talking about the different kinds of defects, as I told you already, the upper limb, especially the spine deformities. Spine deformity is the most common thing that we see is kind of scoliotic deformity, where, as I told you, a zip kind of thing closes from above to below, which makes two different dermatomes into a one. That means two parts of a what is a vertebra, they join and become one vertebra like that. So with that, it forms like entire brick block like that, entire brick block like that. If at all there is some issue with this closure, there is something called as a spina bifida. So we don't know. We are not sure if the spine is also involved, or only the spinal cord is involved, or only the bony spine is involved. So for this also there are further investigations to be done for the baby. So this is the most common thing. And some kind of scoliosis. Scoliosis means the spine has to be straight like that, but it just curves a little sideways like that. And kyphosis is like when spine has to be straight like that, but it bends forward like that. So scoliosis is something like that, which happens when you have this kind of closure will be there now. So one of the piece will be missing like that. So when the spine entirely stands on that, the spine bends on one side like that. So the baby will be somewhat like that, a little bend to right or left, whichever dermatome is missing. So we see that. And block vertebra is also not a, scoliosis is not a very serious problem. If at all there is spinal cord involvement, then only we see the limb movements, the lower limb movements especially. If at all a baby has lower limb issues, and also has innervation issues, like the distal part of the limbs are not functioning properly and the internal spinal cord is also involved, then we give an option to the parents if they really want to continue the pregnancy or discard it. So that is the most important thing about spine I would tell about. Next, the upper limbs, actually there will be something called as a pseudo arthrosis of the clavicle. That means the collarbone is kind of broken in between and then crossed away like that. And then they'll have scapula, spinal shoulder. Actually, post-birth early you'll get to know that. And sometimes there'll be absent pectoralis major. That is this entire muscle will be absent. It is a syndromic case wherein it's called a Poland syndrome and all. So let's not get into too complicated things. So sometimes the limbs will be lost, as I told you, or they'll have a small defect like that. Or they will, that is about the upper limbs, especially having polydactyly, that is having extra finger on this side, on the thumb or the little finger is more common. And another thing, syndactyly, that means the fingers will be joined like that. So this kind of deformities are most common deformities. And talking about the lower limbs, pelvis especially, there are very few. Talking about the hips and other thing, they can be something called as a DDH, that is a developmental dysplasia of hip, but you cannot tell that entirely during the TIFA scan. Only post delivery, only first few weeks of scans are very useful. And next, another thing is your entire limb loss. Like there is something called as PFFD. PFFD means partial proximal femoral deficiency. That means the femur of one side is actually smaller than the other side. The normal femur will be this size, the other femur will be only that much. So the limb length, there will be limb length discrepancy. That means the pelvis will be tilted like that, and one limb will be very small compared to the other limb. So that kind of cases is not a very big deal. We can lengthen the femur post delivery. So we don't advise for discarding the baby. We tell the parent it's not a very serious deformity, we'll continue the pregnancy. And then there can be around the knee, there can be something called as a genu recurvatum. So our knee generally is like that, straight like that, and goes into flexion like that. But sometimes what happened with these babies is that these babies will be completely everted. The leg will be everted like that and touching the the thigh part, the anterior part of the thigh like that entirely. That is called as genu recurvatum. That means that the knee is, that is congenital dislocation of the knee. Most of the babies, more than 50% of the babies will have normal course in life. We just need to do some casting, serial casting, then the baby will recover entire range of movements. We have done a lot of cases like this in Apollo also. So that is one of the most common thing in the knee. Then talking about leg part will be most commonly, there are two bones in the leg actually, the tibia and the fibula. So one of the bone missing is the most common deformity. So when one bone is missing, the other bone overgrows and the limb won't be straight like that, but a little crooked. So that is the most common thing, that is hemimelia, or complete loss of the limb, like distal part of the limb is not present, something like that. And next, coming to the ankle and foot. The most common deformity, musculoskeletal deformity for any baby in any ethnicity of any religion, caste, creed, is CTEV, as I told you, that is called as a club feet, where the foot will be completely inverted like that and looking like a club of a golf like that. So this kind of deformity, I will be especially stressing about this deformity because many babies, more than 10 babies in every 1,000 births actually have CTEV. So many parents who have come to us for this treatment also have very good results. So unless the baby has a syndromic deformity, wherein multiple levels of joints, that is the hip joint, the knee joint, and the ankle joint, if at all the baby has 2-3 levels of deformities, then the prognosis, that means the result of whatever procedures you are doing is not that great. But if at all it is not what do you say, if at all it is not that bad, like it is a single limb involved and the other limb is not involved, or it's not a syndromic baby, it is like just because mother, sometimes there is something called as oligohydramnios. That means that a baby actually needs enough space and fluid to roam around the entire womb of her mother. So whenever there is a little lesser fluid and the mother has nutritionally status is not proper, then the baby's legs get cramped up like that and get into a position like that because of going into a very stiff deformity, that is CTEV. So even if you get a report of CTEV at the age of 16 to 20 weeks, there is nothing to worry about it, because CTEV is a completely treatable condition. Baby will have a complete normal feet with normal activity and a normal life, normal healthy life, who will participate in all sports, no issue at all. So now, first thing is parents, nothing to worry. Second thing is only to diagnose the CTEV during TIFA scans is a little hard for the radiologists also. The most important thing here is that only 1/3 of the patients, that means if at all 3 reports are given that this baby is positive, like 3 babies are given continuously positive, out of them only 1 baby will have a original CTEV that requires treatment. Other 2 babies will be completely normal and that cannot be identified during the course of pregnancy. Only after the delivery only we'll get to know what is wrong with the baby. So this is about CTEV. CTEV treatment will be like we do something called a Ponseti technique, where we, with the foot being like that, we slowly keep correcting it 5, 5, 10, 10 degrees like that and completely get to a normalcy. And then make sure the baby is put on shoes and to maintain the correction for up to 3, 4 years like that. And the baby does really well in life. So this is about the lower limb deformities. So when you're looking about this birth defects, deformities, and all these issues, the most important I would like to tell parents is that keep in mind the etiological factors that as I told you, the environmental factor, nutritional factors, and getting exposed to radiations, having good regular checkups with the gynecologist, and also taking care of proper health and going for good exercises, good walk, and going for yoga, something like that will really help the baby and the mother, and taking very good nutritional food. That is very, very important. And second thing is not getting exposed to unnecessary drugs. Read about every drug that they are prescribing, whoever doctor is prescribing you. And whenever you're meeting a doctor or going for any investigation, make sure you mention that you are pregnant, so that the entire course of treatment, the entire course of investigation and management entirely changes when the patient is pregnant. So make sure you tell that. And another thing is that talking about the next, going for regular checkups and going for a TIFA scanning. As I told you, TIFA scanning, many people avoid in peripheries, especially thinking that it is a little more costlier than a normal thing. And also there are many biases about gender and all these things. So please don't get into that. Having a healthy, happy baby is more important than anything else in this world, actually. I personally seen many parents who have no kids for many years. So they will struggle so much. So whichever baby you are getting, having a healthy and happy baby is more important than anything else. So go regularly for TIFA scanning. See, if at all any doubt, go to an expert consultant who especially does only fetal medicine. We Apollo Cradle, it is available. It's very good. And another thing, if at all you find any defect, don't panic. First of all, don't panic. Discuss the case with the radiologist. That is the person who has done the scan. Especially if at all it is a fetal medicine expert, it's even better. And next, discuss it with your gynecologist. And next, discuss it with the consultant who is really going to treat. That means if you are having if they tell that there is a cardiac issue with the baby, you go to a pediatric cardiologist. And if at all you feel like there's any limb or spine deformity, you can come to us. You can come to pediatric orthopedicians like me and ask them what is the scope of the issue that is going to happen and how the baby's life will turn out after the deformity and after birth and after the corrections. What will be the course of treatment? You can take half an hour time of the consultant and take and ask all your doubts, all your questions, and be clarified about it. And another thing, if at all the consultants tell that no, this baby should not be carried further because it has very bad deformities, please don't go into a very depressed state or anything like that and try retaining the baby, because we know better than you, because we do this every day. So please make sure you consult the gynecologist and the fetal medicine expert and make sure you take a decision, that too as soon as possible, because less than 5 months, that is around 16 to 20 weeks time, is very good time to get it get the abort the baby also, if at all it is a deformed baby with who has no proper prospectus of life in the future. See, the important thing here is that having a deformed baby which will suffer for the rest of its life and also make you suffer and not letting you concentrate on your personal, professional and life with other babies that you already have or are going to have in future is a very disastrous thing. So please listen to your consultants and take their word and take go home, think about it, discuss with your family and take a proper decision. And if you're doing it, take it in a little faster way so that it is good for you, for your health. And also make sure you have gaps between your pregnancies, that is at least 2 to 3 years. That is very good. And finally, talking about all these deformities and treatments, most of the deformities that I have discussed with you are treatable, and the baby generally limb defects, unless they are syndromic babies, usually will have very good course. So if you come very early, that is during just after the birth, like in the first month or something like that, we can give excellent result to the baby and give you very good counseling and give you a very good course of the treatment, like what is going to happen after 10 years of the baby's life, after 20 years, after 30 years of life. So make sure you find out all this and research about it and talk to it. You can go to multiple consultations, that doesn't hurt much, but make sure you stick to one consultant so that one proper person who is guiding you will definitely give you very good result. And talking about all these deformities, they are almost most of them, more than 90% things are very much correctable. So remember, and another thing what we should, as the first introductory madam has mentioned, around 60% of defects, actually you don't know the reason. It is, and science has not yet advanced so much to make sure to understand that, understand what is the real issue. And also another, consanguinity. Also consanguinity means that you are getting married to your very close relatives. Actually very close relatives have a very high expectancy of having a deformed baby. It's not a rule, but it can happen. So if you're looking at marriage proposals, so make sure they are little distant relatives, so it's good for you actually. So this is about it. And I guess about the chest cavity deformities, cardiac and lungs, and what is the abdominal cavity, all these things the pediatric surgeons will be discussing about it. I think I have covered most of the pediatric ortho side, where most of the deformities have been covered. And now we'll take some questions. I've told about 20-25 minutes of the information. So if at all any doubts, anything you want to ask, I'm ready to answer. Thank you for the opportunity. It was a really real pleasure talking to so many people. Thank you. Any questions, or you want me to end the stream? That is also fine. I hope I've cleared most of the doubts and told most of the information. If at all you have any doubt, you can consult Apollo Cradle Kondapur for our consultations. If at all you or your relatives or anyone near you, your neighbors, your friends, anyone is going through stress like this of a baby having told that there is some problem. So if at all any issue like that, please approach us. We are always there to help you. Doctors are actually there to make your life more and more comfortable and happy. Make sure you come for a consultation. Make sure you encourage the people who are really having these issues to go for a consultation. Make sure that this happens, so that it's not only about the baby and the family suffering with a deformed baby. It's about the emotional and also social and economical burden the society also takes because of this baby. Any baby getting into this world actually should be contributory. That means that they should also contribute to the society by doing some work, paying their taxes, and living a healthy, normal, having a very good, normal, healthy relationship with the entire society. So make sure most of the parents or babies who are having these kind of issues, please come to us, and we are always ready to help. Anything else, then you can ask me, and you can approach us for any questions or any consultations. You can take the number from. This is especially conducted by the Apollo Cradle, Kondapur. So I'll be coming there every Monday. So you can approach us. We will give you appointments, and we will help you with any kind of problem you need. So with that, we'll end this session. Thanks a lot. Thank you for the opportunity, Apollo Cradle. And I hope whoever have listened to this, or whoever are going to listen in future, it will be useful for them. And we really don't know from which from which part of the world what we are doing and how we are changing one baby's life somewhere else. So I hope my talk helps some baby somewhere in the world, so that the baby lives a happy life, or a parent will be saved from the trauma of having a sick and a deformed baby. So thanks a lot. So we'll close the chat with that. Thanks a lot.